going to be doing a cardiovascular assessment on you today. I'm going to do some hand hygiene really quickly. Can you tell me your name?
Vivian.
And when's your birthday?
April 5th, 2004.
Good job. So I'm just going to start with looking at your general appearance. I'm not seeing any signs of distress. Your skin color looks good. Nothing is pale. So now we're just going to start with assessing your temporal arteries and your carotid arteries. And they're equal on both sides. I'm going to check your carotid. And we always check that one at a time, because if I check it two at a time, we're going to cut off the blood flow to your brain. And we don't want to do that. Now we're just going to auscultate your carotid arteries to listen for a bruit, and we do not want a bruit. So we're just going to listen to that really quickly. No bruit, so that is good. Now we're going to assess your jugular veins. So what you're going to do is you're actually going to lay here on your back. Let's move this pillow.
Oh, God.
And then you are going to look over to that direction. Let's move your hair. There we go. Turn your head a little more that way. Yeah. And it's this light that we use. And I can see her jugular vein, and sit back up for me. And then when she sits up, we can see that her jugular vein disappears. So that's good. Now we're going to look at your upper extremities. We're just checking your skin turgor. It's good. There's no tenting or anything noted. Cap refill is good. We've got less than 2 seconds on all of it. Now we're going to check her radial pulses, brachial pulses. Radials are good. Brachial pulses are good. We're going to go ahead and check all the rest of your pulses now. I should have had you stay laying down. Lay back down for me. We're going to check your femoral pulses. All right, that's good. Even on both sides, we're going to check her popliteal pulses now on the back of her knees. Those are good. Both good. I'd say +2 and equal bilaterally. Now we're going to check her feet. Take her fuzzy socks off here. And we're checking both the dorsalis pedis pulses and the posterior tibial pulses, and both of those are good. So you can go ahead and sit back up now. One of the things that we're checking for whenever we're checking all of your pulses is checking the rate and rhythm, and that all seemed normal. It didn't seem like there were any arrhythmias or anything like that. So now we're just going to check your lower extremities, doing kind of the same thing we were looking for with your upper extremities, checking for good cap refill, which we have. Your legs don't look pale, they look good, and you have good skin turgor and no tenting or anything like that noted. Your toes are both cool, but it's very even on both sides, so that means it's probably more so related to the fact I took your fuzzy socks off than any actual vascular issue. Oh, hi Basil. So now we are just going to go ahead and, normally at this point I would check your, oh my gosh, I can't think of what it's called. Your ankle brachial, oh, thank you Basil. Your ankle brachial index. But in order to do that, you have to have a blood pressure cuff and you have to have a Doppler, which I do not have a Doppler here. But what that's assessing for is it's assessing for any peripheral artery disease or any other sort of issue with the blood flow. So now we are going to check your blood pressure here really quickly. with my handy dandy tangled mess of serum. You're going to lay your hand just like that for me. It's 118/54, which is completely normal for someone who's young and stays in shape. The lower number, the diastolic, could be considered a little bit low. However, you having like any dizziness, shortness of breath, heart palpitations, so we'll consider her asymptomatic and we'll move on from there. Now I'm just going to go ahead and move on to the last part, just doing your heart assessment. So right here, I'm not seeing any abnormalities, nothing looks uneven. So we are going to go ahead and start with palpating. Which everything feels good, looks good. And now we are just going to go ahead and listen in all 5 points that we'll be listening to here with my diaphragm and my bell. And then we're going to do the same thing with the other side. Everything sounded good. I heard S1 and S2 and there were no abnormal sounds, no extra sounds, no clicking noises, murmurs, anything like that. I forgot to do one more thing. I just need to check to feel if there is a thrill anywhere, which I do not feel a thrill coming from anywhere. So that's also good. So I think that is everything. So thank you for participating in my assessment today.